So Ozempic is an injection that was approved for the management of diabetes. When they were developing the drug, they also noted notable decreases in weight loss with their patient studies. It's what we call a GLP-1 agonist. And ironically, we know about GLP-1 agonists through studying bariatric surgery because that was an upregulated hormone after patients underwent surgery. GLP-1 agonist has notable effects on our metabolic profile. So it helps to increase satiety, decrease hunger, upregulate other metabolic parameters that all contribute to our energy homeostasis or state of being at any given time. Ozempic is safe for weight loss. It's been well studied. You can expect approximately 10% of weight loss when you take Ozempic. And that's really important because any weight loss is important when you're dealing with obesity. However, if you look at it in the grand scheme of things, if you weigh 300 pounds and you lose 30 pounds, while that is going to be beneficial, it's not going to quite get us into a place that really affect our health and our longevity. So some of the side effects of Ozempic involve nausea, vomiting, diarrhea, changes in your bowel habits. It does have an effect on gastric emptying, so then you can get into things like feelings of distension or bloating. The most dangerous side effect is when people's blood sugar drops too low, and it's a clinically relevant hypoglycemia, which unfortunately can be deadly. When you look at bariatric medicine versus bariatric surgery, I think it is important to note that this is a comprehensive approach to a disease process. So both are important in the armamentarium that we use to take care of our patients. When we look between the two, whether using medications or surgical therapy, probably the biggest thing is just effectiveness. Some of these medications are really advanced and we're getting up to 20, maybe even 30% of body weight loss. And that's outstanding, we're happy to see that. But when we look at surgical weight loss, it's pretty common for people to get 65 to 70% of their excess body weight loss. Now that translates to sometimes 100, 130, 140 pounds. And as you can imagine, that's gonna go much further towards improving that person's health and longevity. The second thing would be durability. Unfortunately, with these medications, you kind of have to keep taking those medications to maintain your weight loss. With bariatric surgery, it's much more durable. That's a permanent procedure that has those effects really for the remainder of your life. A third factor that one has to consider is cost. Unfortunately, a lot of these newer medications can be very expensive. It can be hard to get approved by your insurance company. So some people are spending $500, $800 a month on these medications. Even if someone were to have to pay a cash fee for their surgical weight loss, generally speaking, that's going to be in a $10,000 range, but over time, that is a much larger cost savings because once that cost is incurred, you're done. Whether a patient's looking at medically supervised weight loss with medications or surgical therapy, it's imperative to understand that these are just tools to augment healthy lifestyle habits like diet and exercise. Now that doesn't mean you have to rip the sleeves out of your shirt and join a CrossFit gym, but it does mean that you have to have a daily habit of active living and exercise. And when we eat, we have to focus on eating high quality, nutritious foods and eating those in the right proportions.